This is One on One. Right from the start, NJ is pleased to welcome Dr. Kendell Sprott, President and CEO of Matheny Medical and Education Center. Doctor, thank you for joining us as part of this ongoing series, Right from the Start, NJ. You'll see the website up throughout this entire segment. Check it out. It is part of an ongoing educational initiative to teach folks, educate and inform and engage folks about the importance, of birth to 3. Right away, we're going to show a graphic that talks about brain development during that period of time. Break it down for us. What goes on during that time for infants and toddlers?
So on this slide, it talks about the synapse formation, and those are the connection between the brain cells. When a child is born, the number of brain cells is the same number of cells that they'll have for the rest of their lives. Now, the brain cells will grow, but the connections, which really determine the function and how the brain works, start to develop. And they reach their critical point between 2 and 3 years of age, and after that, the number of synapses you see start to decline. And so it becomes important that during those initial 3 years that those synapses be fully developed, especially as it relates to language and some of the sensory patterns as well as the motor functions.
So, Doctor, as it relates to this initiative, right from the start, NJ, what does that mean in terms of what we as a society need to be doing more of, and what, as parents watching right now, by the way, those prenatal care matters as well, as you can see from that graphic. What do we need to do as a society and then individually?
Well, I think as a society, we need to prioritize the importance of this period of time. And that means to recognize if children are having developmental delays, they get the interventions that they need.
How would we know?
Well, part of it has to do with the developmental screening and assessments that take place. In general, the pediatricians do developmental assessments, or are supposed to be doing them during the normal visits. And for a newborn, they'd see the baby at a week, 2 months of age, 4 months of age, 6 months of age, 9 months, a year, and then at 18 months and at 2 years. And so those visits are front-loaded. And that means that the pediatrician will ask the parent, because most of the answers that relate to this developmental assessment deal with speech, social adaptive, gross motor function, and fine motor. The gross motor functions are things like rolling over, sitting up, standing. And I think that if you see that a child is having a delay in one of those areas, it increases the likelihood that there's a delay in another area. And it becomes important that if those delays exist, that interventions occur. And there's something called the Early Intervention Program that's designed to assist the parents and the child.
What is that program? Is it some sort of universal program, and how is it implemented and enforced?
So each state has an early intervention program. Most of the dollars flow from the federal government.
The feds give money to New Jersey.
That's correct. And so throughout the state of New Jersey, they have early intervention programs. Usually you'll see it listed by county, the number of early intervention programs. But those programs are designed to provide the kind of therapies that a child might need in the first 3 years of life. So it could be occupational or physical or speech.
What happens if you don't step in at those points?
I think that if you miss that first 3 years, that critical period of time, you may not be able to develop the full potential of the child by having interventions occur later.
Okay, break this down a little bit. By the way, do you want to read more about these issues? You want to see more excerpts from this series right from the start? NJ, go onto the site right now. I know I keep talking about it because broadcasting, television, should be a way to drive people to get more information. And that's what this campaign right from the start, NJ, is about. So here's the question. When we talk about a societal responsibility, devil's advocate question, people say, you know what, in New Jersey, nationally, there are a lot of priorities. We want to do a lot of things for a lot of people. We don't have the money to do these things in terms of increasing the so-called child care subsidy, providing, frankly, paying more to those who are doing child care, professional work. The parents who are on leave, if you will, from work, the government getting involved, paid family leave, if you will. We don't have the money to do those things, you say?
Well, I think that there is the money to do these things, and a lot can be done if you are creative about how you go about doing it. If indeed our state, our society prioritizes the first 3 years of life, then money can be devoted to it. You know, we spend money for public education. Well, certainly public education could be extended down to birth. We have tax...
But that was not, excuse me, by the courts mandated that in the state of New Jersey in a specific 31 urban, poorer school districts, if you will. Do the courts have to get involved and mandate this for birth to 3?
Well, I think, as you know, there are 3 different branches of government: executive, legislative, and the courts. And what you talked about, it was the courts. But the legislature or the executive branch could make a decision that this is what we're going to do.
Doctor, what would it look like?
Well, what they could do is a number of things. They could basically say, as a state, we want to increase the amount of money that we're going to use to leverage federal dollars that might help address the issue. You could also develop earned income tax credits so that individuals could have a certain write-off for providing for care. They can encourage corporations to devote and give them tax credits to help promote child care.
Corporations, and by the way, in our forum, we had 8 experts talking about this subject, and you said, wait a minute, there was a big federal tax cut from what to what on the corporate end?
From 35% to 21%.
And you said what? What do you do with that, some of that money?
And some of that money could be devoted to help with the child care. In our state, the ability of parents who have children under 1 year of age have extreme difficulty finding child care for their infants. The same thing exists in the 0 to 3. And so maybe a third of the parents that have kids have access to this subsidized child care. Those people that are affluent can afford to pay for it, but even for them, quality child care isn't so easy.
I'm going to give you a chance, Doctor. You've been with us so many times, and I cannot thank you enough for adding so much to this conversation. At Matheny, what parents are you seeing? What are they saying? And how does it relate to right from the start, NJ?
Well, Matheny is a special hospital for the developmentally disabled. And so we take care of the extreme end of the developmentally disabled population. And so we have, in addition to the special hospital where we have 101 beds, we have a private school for the developmentally disabled where we have patients that are in the hospital, that are children that go to our school, as well as about 15 students that live with their parents.
And those parents, do they feel like they're getting enough help for their children, particularly between these ages, if there are developmental issues?
That's a whole nother conversation.
Is it really?
And the answer is that no, they're not getting enough. And again, part of this has to do with how much government puts towards the costs. Again, the funding for developmentally disabled, by and large, comes from Medicaid, and that means that half state and half federal dollars. And so one of the problems that some of the parents find themselves in is that they don't have the ability, if their children are very, very developmentally disabled, to get them into a group home setting. Sometimes that they have to wait until they are adults, and again, by adults we mean 21. And once they get into past 21, they're older, the child is older, if they're difficult to handle, that child can't get put into a waiting list to get into group home until both parents are 55. And so to a certain extent, they feel stuck and they don't see light at the end of the tunnel in terms of being able to care for their kids without any kind of assistance or a limited amount of assistance.
Doctor, I know that this campaign, this public awareness campaign right from the start of Jay, will continue to explore these and other issues. And while you have been a part of it, so far I know you'll continue to be a part of that conversation. Best to you and your colleagues at Matheny.
Okay. Thank you, sir.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Summit Medical Group, Wells Fargo, the New Jersey Education Association, Caldwell University, Kessler Foundation, the New Jersey Office of the Insurance Fraud Prosecutor, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.